Bismillahirrahmanirrahim. Myself Tareem Fatma and today is my presentation and my presentation topic is goiter. Table of content contains what is goiter, what is thyroid gland, reason of goiter, different symptoms of goiter, chemistry behind it, different types of goiter, medication, how we can detect goiter, treatment and side effects. Overview. Goiter is a condition where your thyroid gland grows larger. Thyroid gland is a small butterfly shaped endocrine gland which is located in your neck below your Adam's apple. Your entire thyroid can grow larger and it can develop one or more small lumps which is known as thyroid nodules. Thyroid gland. Thyroid glands plays a crucial role in producing thyroid hormone and these hormones are also involved in body's metabolic rate, growth and in development. It plays an important role in controlling heart, muscle, and digestive functions, and also in the brain development and in bone maintenance. Different causes of goiter. First, we have iodine deficiency. Iodine deficiency is the most common cause of goiter. The body needs the right amount of iodine to produce thyroid hormone. Thyroid hormone is the important hormone which can cause goiter. So, our body must have the right amount of this hormone. If you do not have enough iodine in your diet, the thyroid get larger to try and capture all the iodine it can, so it can make the right amount of thyroid hormone. What are the other reasons? Other reasons contains Graves' disease. Graves' disease occur when your thyroid produce more thyroid hormone than the normal amount, which is known as hyperthyroidism. Hyperthyroidism is the condition with the excessive production of hormones which makes the thyroid larger in size. Hashimoto's thyroiditis. When you have Hashimoto's thyroiditis, it predisposes thyroid to not being able to produce enough thyroid hormone, which causes hypothyroidism. The low thyroid hormone causes the pituitary glands to make more thyroid stimulating hormone and it causes the thyroid to enlarges. In Hashimoto's, we have less amount of iodine, while in Graves' disease, we have the more amount of iodine in the body. Symptoms of goiter. Now, we have different symptoms of goiter. Primary symptoms of goiter is noticeable when next follows. If you have nodules on your thyroid, they may large in size and from very small to very large size. The presence of nodules may increase the appearance of swelling. Other symptoms contain difficulty in breathing, coughing, unexplained weight gain, constipation, hoarseness in your voice, dizziness when you woke up, sensitivity to cold, dry skin and hairs, and brittle nails. These were the symptoms of goiter. Now you can see the picture. Goiter is the most common in women, not in men. What is the chemistry behind it? Now we will discuss the chemistry behind the goiter. Thyroid gland work extra hard to make the thyroid hormone and it increases its cell number resulting in the enlargement of thyroid gland. So, thyroid gland plays a crucial role in producing thyroid hormones, primarily thyroxine, which is T4, and uh, triiodothyronine, which is T4. These hormones are involved in regulating metabolism, growth, and development in the body. The production of thyroid hormone, which are T3 and T4, requires the presence of iodine, which is obtained enough through the diet. The chemistry behind the goiter involved the role of iodine in thyroid hormone synthesis. Thyroid hormone are derived from the amino acid tyrosine and also contain varying number of iodine atoms. Iodine is actively transported to thyroid follicular cells which are responsible for hormone production. Inside these cells, iodine is combined with tyrosine residue and form iodotriosine intermediate. And these iodotriosine intermediates are then coupled together to form thyroid hormones, which are T3 and T4. Now, we discuss the different types of goiter. Colloidal goiter. Colloidal goiter, also known as endemic goiter. A colloidal goiter develops from the lack of iodine, a mineral essential to the production of thyroid hormone. And people who get this type of goiter usually live in the area where the iodine is less. Non toxic goiter. Non toxic goiter is also known as sporadic goiter. This cause of non toxic goiter is usually unknown, though it may cause by the medication like lithium. Lithium is used to treat the mood disorders such as bipolar disorders. When someone take medication which contain lithium, it may suffer from non-toxic goiter. Non-toxic goiter do not affect the production of thyroid hormone and thyroid function is healthy. Toxic nodular or multinodular goiter. Toxic nodular goiter is also known as multinodular goiter. This type of goiter form one or more small nodules as it enlarges. The nodules produce their own thyroid hormone, which causes hypothyroidism and generally forms as an extension of simple goiter. Scanning of goiter. There are the different methods though which we can scan goiter. First, we have blood test. Blood test can detect the changes in the hormone level and an increase in the production of antibodies, which are produced in response to an infection or injury or an overactivity of immune system. Second, we have thyroid scan. This is usually done when your thyroid level is elevated, and these scan can show the size, condition of your goiter, size of your goiter, and overactivity of some parts of whole thyroid. Third, we have thyroid scan. In thyroid scan, they usually done when your thyroid level is elevated, and these can show the size and condition of your goiter. You can see in the picture as well. Next, we have ultrasound. An ultrasound produces image of your neck, the size of your neck and size of your goiter, and where there are nodules. Over time, the ultrasound can detect changes in those nodules and the goiters. Biopsy. Biopsy is the procedure that involves the taking small sample of your thyroid nodules if it is present. The samples are sent to the lab for examination and then result will come in the form of reports. Treatment. Now we have different kind of treatments for goiter. Goiter treatment depend upon the size of goiter and your signs and symptoms and underlying causes. If your goiter is small and your thyroid function is healthy, your healthcare provider may suggest a wait and see approach with a regular checkup. Medications. Now, in medication, if you have a hypothyroidism or hyperthyroidism, hypo means low level of iodine and hyperthyroidism means high level of thyroidism. Oh, sorry, iodine. Medications to treat these conditions may be enough to shrink a goiter. Medications like corticosteroids to reduce your inflammation may be used if you can thyroiditis. Surgery. Surgical removal of your thyroid, known as thyroidectomy. Thyroidectomy is an option if your thyroid grows too large or doesn't respond to medication therapy. Surgery, I can say, it is the end solution after medication. If any kind of medication doesn't help in your goiter, then we can do surgery. Radioactive iodine. Radioactive treatment is the most important treatment. and in the people with toxic multinodular goiter, radioactive iodine may be necessary. The radioactive iodine is ingested orally, and then it travel to your thyroid through your blood, where it destroys overactive thyroid tissues. For the most people, one dose of radioactive iodine treatment will cure hyperthyroidism, and thyroid hormone level returns to the normal within 8 to 12 weeks. And in rare cases, the person needs a second and a third dose of radioactive iodine. What are the side effects of radioactive iodine? Some side effects of radioactive iodine treatment include multi-taste, metallic taste in your mouth, dry mouth, sore throat, neck pain. Radioactive iodine treatment make your neck swell up or hurt, nausea or vomiting, usually mild, constipation, and also fatigue. These were the side effects of iodine treatment, radioactive iodine treatment. General side effects. A goiter is usually painless but may cause pressure related symptoms, which include a feeling of neck fullness of tiredness, difficulty in swallowing food or even water, difficulty in breathing, coughing, and changing in your voice. Home care. Home care depend upon your type of goiter. You may need to increase or decrease your iodine intake at your home. If a goiter is small and doesn't cause any problem, you may require no treatment at all. Now, what would be the food routine with goiter? Food that contain iodine includes saltwater fish and shellfish, seaweeds, dairy product, and soy product. Thank you. That's all from my side.